in by, there it is. You can opt into closed captions by looking at the bottom of your screen at your individual Zoom controls there. If you click on the More menu, you should be able to select subtitle, and that is what should bring up your closed captions. All right. If you have any issues with closed captions, please note in the chat and Nathan will assist you. All right, thanks for being here with us tonight for Compass Housing Alliance Navigates. Welcome to our staff members, board, ambassador council members, supporters, and members of our local community. I see many of you here. We hope you find tonight's presentation and conversation actually to be both informative and inspirational. And my name is Liz Gerard. I'm the director of housing, or I'm director of advancement for Compass Housing Alliance. And I've been with the organization for 8 years and dearly love the work we do and dearly love my team. So I'm happy to be here with you all representing the organization. For those of you who are joining for the first time, Navigates is a speaker and conversation series designed to bring our community together to learn, collaborate, and foster understanding by exploring the complex, intersecting, and underlying issues of homelessness and housing affordability and what we can do about it. Some of you may have joined us last year to hear from Professor Josephine Ensign, mental health professional Erica Spongberg, or most recently from VA Medical Director of Homeless Primary Care, Dr. Simha Reddy. Tonight, Marc Dones joins us. They use they, them pronouns. They were appointed to lead the new agency in 2021 as the Chief Executive Officer of the King County Regional Homelessness Authority. This is the organization tasked with unifying cities across King County and scaling up our region's response to the homelessness crisis. Marc has experienced housing insecurity and knows the social service system from the inside. Marc is also a social entrepreneur, policy strategist, and social justice activist with over 10 years of experience in equitable systems transformation. Prior to taking the role of inaugural CEO for the King County Regional Homelessness Authority, they were the founder and executive director of the National Innovation Service, a consulting firm that helps governments redesign their approaches to supporting marginalized populations. Marc has also held leadership roles in social impact, policy and program design, and continuous improvement at the Center for Social Innovation. They hold a degree from NYU in psychiatric anthropology and are an experienced equity trainer. Tonight, Marc will be sharing about the Regional Authority's 5-year plan to dramatically reduce unsheltered homelessness in our county. We invite you to participate in tonight's conversation. Please feel free to add questions to the chat as we go, and we will also have plenty of time for discussion at the end of the presentation as well. Marc, thank you so much for being here with us. It's an honor. Feel free to take it away, and I'll bring up the slides.
Thank you. Well, thanks for having me. It's a pleasure to be here with you all and good to see some familiar faces. Frankly, in some different contexts. I feel like the only time I really get to see Mary is when there's something happening with the weather. So it's nice to see Mary in a moment when the weather's fine, you know, and to have a conversation with you all about our draft 5-year plan and where we're headed. So as soon as the slides are ready, I will get going. All right. We can just dive in. Next slide, please. So at a marquee level, I think what's really important is that the 5-year plan is focused on dramatically reducing unsheltered homelessness. And I want to be specific about that because I think we all know that there are multiple forms of homelessness, all of which are unnecessary, should not be happening. And we do need to truly end homelessness writ large. What we at the authority in consultation with community members and regional leadership really heard both from our own folks on staff with lived experience and expertise, and then other folks across the community experiencing homelessness, is that the first thing that we really need to focus on is ensuring that our unsheltered neighbors are coming inside and are coming inside quickly and safely. Next slide, please. So a little bit about where we are. So this is sort of progress to date. I think, oftentimes we don't get a holistic view of what's going on with the system and its response, not just from within the KCRHA work, but also across the ecosystem. So, over last year, 2022, over 5,000 households have come inside from homelessness and are in permanent housing. Last year's exit rate was higher than the rates for the 2 years prior. Our emergency housing voucher program has successfully housed over 1,300, almost 1,400 households. It is one of the very best emergency housing voucher programs in the country. We have actually, that's a little out of date, we've resolved 14 entrenched encampments, long-term entrenched encampments, through the combination of our right-of-way work and our Partnership for Zero work. Combined, those have brought in over 350 households. And then again, looking at the broader ecosystem that's not just within KCRHA, hopefully the crisis center levy will pass and we'll be able to think about that expansion of important behavioral healthcare supports. And then we continue to work closely with partners to see the expansion of permanent supportive housing. And, really, again, similarly, really grateful to Mayor Harrell and his team for a really ambitious housing levy that would continue to boost that production. Next slide. So how is the plan developed? Oh, it's a terrible photo of me. How's the plan developed? So to create the plan, we wanted to focus first on the data, right? So we are a data-driven agency. We needed to develop a more accurate count for the number of folks experiencing homelessness, and we partnered with Commerce in order to create, or piggyback, I should say, off of their complex enumeration methodology to understand the number of people in the county who we believe to experience homelessness annually, and specifically the number of folks who we think experience an instance of unsheltered homelessness every year. We also collected detailed information on all available services. So the authority has the most complex and complete understanding of all services that touch folks experiencing homelessness in the county, again, inclusive of things that are directly funded by the authority, things that are not funded by the authority, things that are in adjacent systems but touch folks experiencing homelessness as part of their core mission, et cetera. We identified permanent and temporary housing solutions needed. That work really, again, leveraged a lot of interviews with folks experiencing homelessness to understand what were the types of housing responses or emergency shelter responses that were going to meet their needs. And then we engaged the expertise and feedback of folks experiencing homelessness, community leaders, and of course, service providers and advocates who've been doing this work for a long time. And so when we initially dropped a draft plan, really towards the end of 2022, we then went into an extensive, public comment period, got a lot of feedback, worked with a lot of different stakeholders to incorporate that feedback. And the current iteration of the plan does look substantively different, and I think, has gotten much better, frankly, as a result of all that community input. Next slide. So what are we going to do? How did we get here and where are we going, right? So the national and regional economic impacts of an underfunded social safety net, wage inequity, rising rent, like we all know those things, but I think it's really important that we always center those as the sources of homelessness, the causes of homelessness, I should say, are very different in some instances than the solutions. And those causes are uniform pretty much across the country, right? So the legacy of discrimination, we had COVID-19 exacerbate root causes, underinvestment in prevention, and then a King County system that was significantly fragmented. I think a thing that is really critical to understand about, sort of the landscape of how we got here and that uniformity is that every community, and I take this from the time that I did national work, every community has different strengths to bring to bear to solve homelessness, though. And so really taking into account King County's uniqueness and then the uniqueness of the 39 cities and communities within King County and all of that rich variation is really important for us to understand as we think about what the solution architecture is moving forward. Next slide. So let's talk about the need a little bit. I think it's, I think we are used to seeing numbers, particularly coming out of the point in time count, that are much lower than this. Again, because we worked with Commerce to develop a much more robust, valid statistical model of how many folks are experiencing homelessness in the county, leveraging, frankly, some of the integrated systems modeling that the Department of Community and Human Services at King County did prior. We now believe that there are roughly 52,000 folks who experience homelessness in the county over the course of the year. I'm going to skip down to that last bullet first and just say about 23,000 of those folks we understand to be experiencing an unsheltered form of homelessness. And so we need to be able to develop and deploy a system that is capable of bringing inside that number of people each year over the next 5 years. Based on modeling from Commerce, we also understand that we are missing about 48,000 permanent housing units and about 36,000 temporary housing units, again, over the next 5 years. An important delineation, and I think that there was some confusion about this from the draft plan, is that, there was this, well, the authority is asking for $12 billion. Incorrect. The draft plan laid out assumptive cost for both the permanent housing and temporary, response units. And really, the authority is going to be focused on those 36,000 temporary units, right? That emergency response, the work that is necessary to bring folks in right away. Next slide. So, I think I was mentioning this before we got started. I'm coming off of a 12-day emergency activation, and this feels more important to me now than ever, actually. Partnership is really what makes big things possible. And so if we're going to meet this, immediate need for additional temporary and emergency housing and supportive service, which is really critical, and expand coordination across the system, we need to work holistically. And we really need that all hands on deck community-wide response. I'm quite tired because of the 12-day activation, but I also feel a lot of gratitude. I got to participate in something, where we had many service provider agencies, some of which who are not, part of the titular homelessness system, and we were doing daily 8:30 a.m. calls, through the weekend, deploying to sites across King County for, sometimes 8-10 hours a day after these coordinating calls. And every day I got to see 40 people or more show up to an 8:30 a.m. call, prepared to lead and prepared to do what was necessary for our most vulnerable populations. And that, I think, is the future that we want to see. It's not a future where KCRHA is the center, where, the authority is sort of this entity that is doing all the things, right? That's not what the vision of the authority is. The vision of the authority is to be a sort of unifying space where we can all have the right conversation. It's where we all become the all hands on deck community-wide response. And coming out of this activation, I really do see that as possible. And I think that there is such tremendous leadership in this community and such tremendous capacity in this community. And if we all go in the same direction with all that, talent and resource, I think that really, really big things are possible, inclusive of, first ending unsheltered homelessness and eventually ending homelessness for everyone. Next slide. So in that, again, let's talk a little bit about our role, right? So we really see, the overarching goal of the plan as bringing unsheltered folks inside in a way that meets their needs as swiftly as possible. And one of the things that I really want to create some balance here around is that I think oftentimes we have talked about meeting people's needs, and we've talked about doing things quickly, and we have seen those as antithetical, right? As you can't do both. And I think that, in partnership, what we have found is that you can. It just requires that you really shift the way that you work in some ways. And when we look, for example, at those 14 entrenched encampments and those 350 plus households that have come inside just through that work, I think that is an example of where we have been able to both work quickly and bring a whole lot of people inside, because those 14 entrenched encampments have been resolved in under a year. And the rate of folks coming inside from each of those encampments is well above the 90th percentile. And the rate of retention in placements is well above the 90th percentile. And the reason for that is that we didn't just focus on moving quickly, we focused on meeting people's needs as we moved quickly. So really building out those individual case plans, really understanding, if you have been unsheltered multiple times, what didn't work in those other placements, right? Like, what are the services, supports, case management, et cetera, that you didn't get? Do you need inpatient treatment? Do you need, a better behavioral health provider? Do you just need to be closer to your family? These are all things that really matter in terms of making a housing placement sticky, and you all know that. But I think that we can do those things and move with real urgency. And so the overarching goal here really does try to put those things together and make a strong commitment to moving forward inside that sort of melded space. Next slide. So what does success look like? I'm a big believer in defining what success looks like at the outset of a project, so that we can all again be moving towards the same thing. So for us, after discussion with the community, first, it looks like every service provider having the resources to implement best practices and the ability to recruit and retain the necessary staff. And we know that we're not there right now. But that has to be the core of success, right? Is that the folks who are doing the work have what they need to do it with real excellence. We also want all service providers to be able to coordinate response capacity with better data. Every subregion needs to have the right services, and disproportionately impacted subpopulations need to be served. And that coordination, I think, of the data is actually, while it feels wonky, I think it also is really key. We're doing some of the after action work today, from this incident. And one of the things that folks lifted up was that we were able to move so quickly because the authority staff were really dedicated to having good data and having that data transparently shared, both at the beginning and the end of each day, and using that data to really drive decision-making and drive deployments in a much more real-time way than folks were used to, because of the way that our current data systems, frankly, really prevent the sharing of that real-time data and driving towards that real-time decision-making as a result. And so I think we do see a role for the authority there in making significant improvements to that data infrastructure across the county, so that we can all be sharing that information and having those same conversations. Additionally, we want to make sure that multiple systems can coordinate supportive transitions, and we're leveraging every opportunity to prevent homelessness. So, I think we all have seen, right, when someone makes a successful exit from the homelessness response system, and then we see them come back, right? We don't want to see that anymore, right? We really want those pathways not to be leaky, so to speak. We want them to be, sort of hallways rather than, I don't know, sieves or sieves. Ugh, too tired. And for folks to stay where they wind up. I'm working on a case right now, really unfortunate, where we have a medically fragile senior who was in a nursing home and now is experiencing unsheltered homelessness. And that shouldn't be a thing that we're really, frankly, talking about, right? Like we should know that when our folks get to where they're supposed to be, that they are able to stay there, and that placement is going to prevent us seeing them in an unsheltered position ever again. Next slide. So how do we measure success? So the biggest thing is we need to understand the number of people who are accessing or entering the homelessness response system. That is, often discussed as inflow. But I think that we need to be really clear that in this instance, it's not just inflow into the system or inflow into those unsheltered positions. It's also about access, in that when we start engaging with our unsheltered neighbors, particularly those who are experiencing chronic homelessness, and we've seen this in the Partnership for Zero data, roughly 20% of those folks have never had contact with the homelessness system before. And we really need to drive that number down, right? And make sure that folks are getting access to the supports to move forward. And then, of course, we want to understand, what are the numbers of exits to permanent housing? That's the most important thing. How many people are we touching, and how many people are getting housing as a result of those touch points? And then measuring returns, right? We're going to be looking at 6, 12, and 24 months. And then also looking at the number of temporary and permanent housing units. What actually is the ecosystem that we have to bring folks inside? Length of stay, which is often referred to as throughput. I think folks may have heard me in other discussions. I have a lot of concern when we see these multi-year stays in what are supposed to be sheltered positions that should be moving more quickly to permanent housing. Recognizing, right, that like our ability to move people onto permanent housing is subject to the availability of that housing. But I think that we can do a little bit better to, even with our current market and our current vacancy rates, move folks forward a little bit faster. And then disaggregating data by program type, household type, subpopulation, and of course, race and ethnicity, so that we can see really clearly the impact of our work on our most disproportionately represented populations, and see which programs are performing the way that we need them to, which programs might need some technical assistance or some support, or do we need to all sit down and sort of, again, rethink what it is we're doing and redefine how we are trying to get to these success measures. I want to be really clear because I think this is really important. I think metrics, I don't think we should weaponize metrics, right? I don't think we should ever use metrics as a way of penalizing folks. I do think, right, like metrics are a management tool. And so how we should be using those metrics is really by, again, to come together. If we see that something is not where we need it to be, it shouldn't be a punitive conversation. We should all be able to say, okay, so this isn't working. So what do we need to do in order to make it work? And I'm hopeful that as we reset how metrics work across the system in some spaces, that we're able to also reset the discussion around them so that they do become that collaborative problem-solving tool rather than, again, a sort of weaponized contract-based discussion. And I'm really hopeful, again, because of the kind of work that I've been able to be part of in the time that I've been here, that we can get to that space collectively. Next slide. So focused right now on optimizing existing funding in our current budget. Obviously, to get to the scale that we need to, it is going to cost a lot more money. We need to think about both how do we get additional revenue, and we need to think about how we better use our current dollars in alignment with what we all know works. We need to leverage federal funding. I know there's a lot of questions, I think, in the media and other places lately about the use of Medicaid funds. My background is actually more from the formal health policy space before I transitioned into housing and homelessness some years ago. This is a space that I feel relatively confident about, and have worked with a lot of the national technical assistance firms to figure out what the path is here. And I think that we can better utilize federal funding in order to drive some of the expansions in revenue that we need in order to have stable funding in the system for services, and in some cases capital. Increasing the capacity for services like outreach, shelter, and emergency housing. Again, improving data and dashboards and including better information about populations that are disproportionately impacted. And then next slide. So we're also, very focused on developing real-time bed availability so that that will be accessible to everyone, so that we know what's available on any given day, as opposed to what we are doing now, which is reporting out on more aggregate or trend level data about bed utilization. We need a tighter partnership with behavioral health and public health agencies. I think we all know, from our work or our touch points, that like many of our folks, have some substance use or behavioral health issues, but there's a subset of our folks who have really intense behavioral health or substance use issues, and those folks need clinical support. It's not a question of case management. It's not a question of connecting people. It's in some instances, right? Like folks need those medical stays, those inpatient stays, and we need to be partnering and make sure that we have access to those spaces. Again, it's why we're really hopeful about the passage of the crisis care levy. Improving severe weather response across all subregions. I think, we've built a much stronger engine, and we're seeing much stronger countywide coordination. We want to get better and really save more lives, frankly, during those severe weather incidents. Increasing support and funding for our BIPOC organizations, developing programs in partnership with our youth and young adults, and really working to focus more of the system's energy on really ending youth and young adult homelessness. Continuing our emergency management approach to ending homelessness. I think, Partnership for Zero is functionally a brand name. Don't tell anybody I said that. The core of it is really about using emergency management techniques to drive the work. And I think, some of the really impressive stuff, again, that I've just been able to be a part of, I'm happy to talk about in the discussion, really shows what's possible when we use that model to make decisions every day. We need to make sure that we are partnering with all 39 cities across our subregions and developing those really strong relationships, and making sure that we are able to appropriately cite resources in all of those communities. My fundamental belief remains that every community needs to have resources in it to respond to their own neighbors, right? This shouldn't be a discussion about, oh, you want to move people from here to here. It's more that housing instability and homelessness happen in every community, and every community needs to have the resources available to respond to their own folks. And then, of course, related to that, advocating for more affordable housing. Housing is the solution to homelessness. And until we have enough affordable housing, there will always be a need for an emergency response system. I would love one day for that not to be the case, right? For agencies like KCRHA not to be necessary, because we have, as a nation, made a decision to prioritize having affordable housing stock for folks at all income levels. And, for as long as, the current staff of KCRHA are in our roles, I think you can expect to see a strong advocacy from the agency for increased affordable housing development. Next slide. So I'll just close by saying, I think we at KCRHA believe it's possible in homelessness. We believe that every person deserves a roof. I think many of us would not show up every day, would not work these really, really long days if we didn't believe that. And so I think oftentimes in these conversations, there can be, unfortunately, some cynicism about, what's possible, what it's worth having hope for. But I think that, speaking on behalf of our team, we come to work every day with that hope, and we leave every day with that hope, because we don't think that agencies like KCRHA should be the norm. We think that healthy, thriving communities should be the norm, and that is possible for us to achieve. So that's all I've got, and I'm happy to have discussion.
I'll go ahead and stop the share. Thank you so much, Mark. So much of what you shared really resonated with me. I'm sure percolated some thoughts and questions within the audience. I do want to touch back on your emergency activation. Some folks in the room may not be totally aware what that was related to, but you all did a heavy lift over the last 12 days. Do you want to share a little bit more about that? And especially in light of this thought about how we respond to homelessness as a really urgent human need, like we might with a tornado or some other natural disaster. It's truly a disaster as it is. So, you know, the emergency approach is great to hear about. So thank you.
Yeah, I think so just to read people in on the incident, it was in the Times over the weekend, but a very large shelter program was spun up by an agency that does not run programming through a grant actually from FEMA that did not pass through the authority. So it was not an authority program and was not formally connected to the system in any substantive or meaningful way. We were informed rather abruptly that the program was roughly $1 million over budget and was going to close immediately, and that well over 200 folks were going to be exited back to unsheltered homelessness all across South County if folks didn't intervene. On April, I got a calendar. On April 13th, we began to ramp up. The decision was made that we were going to activate. I remember being on the phone with a number of our provider colleagues, well into the night. And then on April 14th, we formally activated, which for us means, and again, I think Mary and some of the Compass team know what an activation feels like. So for us, that means that we formally adopt an emergency management approach, which is that is a real shift in posture. Staff from internal to KCRH are activated to specific roles to manage the incident. We also work with provider partners to activate them to provide things that are, in their wheelhouse, right? Whether or not it's shelter supports or outreach or, certain kinds of engagement, et cetera. In this instance, what made it very difficult is we had no idea who we were going to be working with, right? This was, again, not a KCRHA program. We did not really understand how many people. We were getting inconsistent reports of the number of people who were in the hotels, inconsistent reports of where the hotels were. So there were a lot of unknowns. Friday morning, we had our first operational and planning. We met from 9 to 11 and then deployed that afternoon to the known sites to begin developing what's called a by name list, or BNL, for each site. The next 48 hours, so Saturday and Sunday, were really focused on that BNL completion, needing to know who was in all of these hotels. At peak, we identified, again, around 200, and I think it's 216 total individuals across the sites. On Monday, we started triaging based on available information. So we started looking at, okay, so we know that the system does not have 216 anything on a good day, right?
Yeah.
And so need to immediately begin understanding who is the most vulnerable, who do we need to be prioritizing. So we began to triage households. We had a focus in those first days, so Monday and Tuesday, that would have been the 17th and 18th. We were very focused on households with children under 10, households that had someone who's medically fragile. We encountered folks with multiple amputations, folks on oxygen. We had a baby on oxygen. We had, just again, like lots and lots and lots of medically fragile folks, and then seniors, for our purposes, 55 and up. So those households we prioritized as needing to stabilize and ensure that they did not return to an unsheltered position out of fear that they are the most statistically likely to die. And so we begin prioritizing either housing or getting those folks into a separate shelter placement that we knew was going to be sustainable, where we could work with them to get housing over the next several weeks. We effectuated in between Monday and Wednesday the vast majority of our priority household moves, which were roughly I think about 65 total individuals that we moved into some of these other locations. We also, through I think some really, really, really sharp deployment of rapid rehousing, we were able to generate almost 40 housing exits pretty rapidly over that first set of days. On Wednesday, the 12th, most of the priority households had been moved into either housing or shelter placements. So we then expanded and began working with all the other households to understand what their needs were, what kinds of, again, shelter exits we could generate for them. That work was moving forward. And at the same time, we began to work to understand whether or not, frankly, at that point, the burn rate, so why couldn't we just keep working with these people? Well, the burn rate on the program that had been set up by this agency was roughly $40,000 per day, or about $1 million a month, with no services. And so it just wasn't a financial possibility, right? Like, as you all know, we don't have that kind of money. And so we could not indefinitely extend their placements in these hotels. They had to be closed, or folks needed to move to some location where we could contain cost and provide service support. So we began working with our county and state colleagues and City of Seattle colleagues to try to identify resources to do a more thoughtful and complete ramp down. Really grateful to the governor's office and our legislative colleagues, in particular, Senator Wynn, Representative Macri, Senator Couderer, who were extremely responsive and extremely helpful. They were able to find money in underspend in the current state budget that they then reallocated to us to extend our capacity to do ramp down between now and June 30th. So not a ton of time, but a lot more time than we had. And so as a result, that coupled with the fact that we'd gotten people into more stable positions, we had cost contained out of the hotels, we'd gotten all of the folks connected to services, we deactivated formally this morning, and then are going to continue in a heightened posture through June 30th to make sure that folks are connected. And just to give people insight into, again, like, what does that look like? So every morning at 7:30, we would meet internally, map out what we knew. At 8:30, we would be joined by about 40 different, 40 different staff from a bunch of different provider agencies. We would set the operation for the day. We would deploy, be in the field, often no later than 10. People would then work till sometimes 8, 9 at night. We would then bring back the data from the day. The KCRHA team would reset that information. We'd get our end of day dashboard and then run that same cadence again the next day. Lots and lots and lots of troubleshooting, of course, over the course of the event. We had a baby get born. We had multiple people go to treatment. We had, if there was a thing, we had it.
Well, thank you. Again, this wasn't originally on your plate until it was, and that's a community approach. And so I'm just really grateful to your entire team and all the network, I know, of community members and providers and state who stepped in. And, you know, it just goes to show when you treat something like an emergency, the lifts that can happen. They may not be easy, they might be quite painful, but, you know, coming from a provider's lens, that's quite the lift. And, you know, we as a community have quite the lift ahead in order to achieve the goals of the authority, which, you know, we all, I hope, you know, we all can agree are laudable in what we want for our community. We can do better, we should be doing better, and we should all be putting a shoulder in and pushing in this fight for our community. So, you know, with that, we've got a couple questions on the board. One from our board president, John Perino. He's asking, you know, as board members, employees, supporters, you know, what do you suggest is like the one thing we can do to help promote the work of the objectives of the regional authority?
I think a couple things. One, you know, advocate. So, like, and I want to be really, really clear about that. Not to us. We know you need more money. We're like, you don't have to convince us. Like, it's the broader authorizing environment that we need to work inside of and attempt to get more resources into the system to do the important work. And so oftentimes I think, you know, the way the system used to work, it made sense to meet with the agency, government agency directors, because they did have direct access, but the authority doesn't have, you know, we don't have taxing authority. We don't, like, you know, we can't just make revenue. And in fact, in this current fiscal environment, most folks at the local level can't just make revenue. That's more of a state and federal discussion. And so I think that is a really important place where we need a lot more voices consistently. The second thing I would say is push for a more nuanced discussion, right? Like, you know, again, thinking about that, well, is it going to be done well or is it going to be done fast? Well, you know, like, why not both? And let's talk about what it costs to do it well and fast, right? And let's have that conversation in a really honest way. A friend of mine on this topic once said, you know, we have no problem acknowledging that, like, if you want your package delivered overnight and not broken, you're going to pay $20 instead of $2. But for some reason, when we switch it to this space, right, we think that it should still cost $2 and also be done really quickly and really well. So we need to push for that, like, nuanced understanding and frankly I don't know, more realistic understanding and discussion about, like, well, this is, like, we live inside the market, and the market, you can get almost anything you want if you're willing to pay for it, right? Yeah. The third thing that I would say is we're like essentially a year and a half into operancy, and so we got a lot of kinks still. And there are some things that, like, we're not gonna know if people don't tell us. And I love this community. It's why I elected to come here. But sometimes people don't tell you something and then they're very mad about it. And you're like, well, I was actually never informed that this was not working, right? And, like, so I would love if folks would, I mean, like, even, like, literally me, right? Like, I don't, like, right now, right, I think we're working through a number of contracting things, right? And I think that there are some things that are working, some things that are not working. And I think it's important for us to just get that feedback, right? And I will say that, like, you know, I'm not getting it. And so I don't know what I don't know until it hits a boiling point, and then I'm like, oh, well, if someone had told me, you know, 6 weeks ago, hey, I think this is going to be glitchy, and I think here's what we can do to work around it, right? I will just speak personally. I'm super open to that kind of discussion, right? And I think most of our team is. But I think that we would love the opportunity to have those discussions in dialogue and not to default to it's an antagonistic posture, right? And, like, we're trying to force something. Like, we're just trying to get things to work, right? And in many instances, I think we would love to have more robust discussion with in particular, again, our provider colleagues about like what improvements can be made, and also to explain, if it is helpful, like what limits we have, because we do have quite a few limits on how we can operate. And sometimes, like, it's like, okay, that's going to be a feature, not a bug. So how do we plan around it instead of collectively getting derailed by it? But particularly as we implement not just contracting, but 5-year plan, like all the things, right? That's going to be, we're going to need to be in routine communication and stepping into those brave discussions. And I would really appreciate if folks would come to us with their concerns, right? I for one, would love to hear them.
Well, I appreciate that. I mean, especially from a funder to a provider, there's an inherent power structure there, and you don't know, right? And so it's really, really lovely to hear, that you are open to that. I think that'll create more success for everyone, which is why you remain open. So really appreciate that.
Yeah. Thank you, Marc, for such a thorough answer, a 3-part answer. That's very kind of you, especially after 12 hard days. So thank you for joining us tonight.
Thanks for having me.
Thanks, John. We do have a question actually about our follow-up. So the 6-12 24-month follow-up after permanent housing. Why not a 1-month retention measurement so that we can assess if the program is serving the folks that are in it?
Yeah, one month is we know. I mean, like, so let me take a step back. When I say that we'll be measuring at 6, 12, 24, I mean those will be like the discrete data points that we routinely report out on and say, like, okay, like what's happening at this point, at this point, at this point. But the way that the data capture works is we actually can see at the 1-month mark, like, are folks still in the program or not, right? That is something that HMIS data does currently provide us insight into. And it's why I'm also able to say, for example, with our encampment facing work, that we do have that over 90% retention rate, because even for some of those folks who really just came inside, for example, when we resolved the large encampment in the CID, right? Like that was less than a month ago. I still know where all those people are. So this is more about like what would be on a dashboard, not about what we would know. I think it's a valid question though, about like, whether or not there needs to be a 1-month, sort of report out at the dashboard level. And I'm certainly willing to take that back to the data team and get their thoughts on it.
Thank you. Yeah. And, back to something you said, you're not a you're not a tax revenue generating entity. You have a pot of money to work with, right? And when we talk about advocating and really connecting the value of our work, one of the things I think is a misnomer that like, oh, well, they should be doing it for peanuts because it's a noble cause, right? They're, this old model of, well, if you work for a charity, then you should be on food stamps. But, we at Compass, all the other providers, our sister organizations, we perform professional services that are highly skilled and have a great burden attached to them in some senses. Right. And so, when we talk about advocacy, yes, that's also talking about money, because these are professional services in an extremely complex context, medically, mental health, right? The integration of multiple systems. So yeah, I absolutely agree. And if we can all appreciate this type of work for the value that it brings to the organization or to the whole community, I suppose, then I think we would maybe be in a different place with our revenue.
And just briefly, like if I could again, just given a story from this past activation, that baby that I was talking about, the mom had some substance use issues, some behavioral health issues. There was a lot of work that went into getting her to the appropriate medical care, and so we had folks working across on the phone with physicians, talking to her, trying to work with her through a care plan. At the same time, trying to work with the fire department and, EMTs. At the same time, we had a staff person from a different agency who happened to be a doula drive down to South County to sit with this woman and really talk her through and say, I know you're scared, right? But like, let's talk through like what's going to happen for you and your baby if you don't go to medical care versus if you do versus what I can, like, so like when we often, I think, have this discussion without the narratives behind it, right? As if it's just shoving people into apartments, and that's not the work we do, right? And I think that when, so the story that I just glossed, right, has 6 domains of clinical care in it. And the idea that the person who coordinated all that, right, shouldn't be compensated for the incredible work that she did to make that happen and to get that mom to a safe place that night, it just doesn't make sense to me. And I think, again, we need to be just so laser focused on being clear that like the work that this sector does is complex emergency response work, and needs to be thought of in that way, and not in the, I think you're right, in that classic sort of, well, you just dole out bread, and like, no, that is not the work.
Yeah, absolutely. We have a couple more minutes, got a couple more questions in the chat, and of course, feel free to raise hands too, folks. Question here about folks who are elderly, more medically fragile. We're aware at Compass that as baby boomers continue to age, that the aging of our population, we are noticing a significant increase in the age of our population, early onset dementia, more complex medical issues. So how is the regional authority prioritizing or planning to bring that population inside to support them?
Yeah, this is a great question. And I think, so we have identified a significant uptick in the number of unhoused seniors, some of whom are experiencing homelessness for the first time. Really scary stuff. As I just mentioned, for the emergency operation, we prioritize that population in terms of getting them into stable placements, first, right? I think that what we'll continue to do is look at how we can, again, add a priority dimension to that population so that we're making sure that those folks are stable. One of the things that's tough, though, and I want to be really clear, is that the authority cannot become the long-term care system, right? That's not what we're set up to do. And so grateful to have the strong partnership of, Director Floor, Executive Constantine, and the county, on, helping to, expand that capacity. It's one of the spaces where I think, just frankly, low-income housing and permanent supportive housing expansions are going to be really, really important over the next 5 years, because what we really want to do is provide our elders the ability to age in place and age gracefully, and if necessary, have support. And I think that there are, some scatter site models for, elderly PSH that are quite, well documented as being effective, particularly if the person doesn't have any significant cognitive issues. So we're definitely going to be leaning into that discussion, but also trying to be clear about what our lane is, so that we don't wind up, frankly, taking on another system's job. And if I can go back to the first question, I would say another strong place for advocacy is hold these other systems accountable, right? Like, every time a person comes to experience homelessness, some other system has failed, right? And I want to be really clear about this. Like, you don't go to an emergency room and get mad at the emergency room doctors that there are a lot of people in the emergency room, right? You don't get mad at a cardiac surgeon because someone has a heart attack. Where we focus our energy is, again, on, we got to prevent heart attacks. We got to keep people from cutting themselves in the kitchen and needing to go to the ER. So we need to really refocus our frustration and be clear that a homelessness response system that we are the ER, right? And if we want to see different outcomes, we need to be pointing to those upstream points where people are entering into the ER, so to speak, and saying like, this is unacceptable. Again, I should not be working to get a senior who was in a nursing home back into a nursing home. That doesn't make any sense, right? There's been a failure there, and that failure is not the staff of the responding agency.
Yeah, indeed. Well, speaking of, thinking about how we think of our work, we know that in King County, we don't have buy-in from all 39 cities and towns in King County yet for the regional effort. And we know we have some newer friends in the mix, like the city of Shoreline. Can you talk a little bit about where you're at right now with engaging and bringing more folks into the fold in our county?
I think we're doing well, frankly. I think so we had the North King County communities sign an interlocal agreement that they're now providing funding to the authority for services. We hope to see that funding allotment grow. We're currently in, beginning negotiations with some of our other subregions. We're trying to sort of work with blocks of communities, right? And again, understanding that the subregion has specific needs and we want to be able to account for those needs. I think that, the more that we are able to show the value of we all come together and talk about it, right? And that actually gets something done. So again, this emergency activation, when we do severe weather, when we do things together, many hands make the work, I don't know if light is the right term here, but they make it possible. They make the work possible. And I think the authority is starting to demonstrate that promise can come true, right? The authority can be the vehicle for our community's will. And that, again, that's part of why I'm saying, come tell us the contracting isn't working. I don't care. Our job is to hear from people and again, become the vehicle of the will. So that I think is a thing that we are starting to be able to show the real promise of. And so I'm seeing those communities start to say, okay, I can get behind that. I think the other thing is just that we do have really great ways of engaging with our unsheltered neighbors in encampments and bringing folks inside. And again, I think as people struggle with encampments across the community or across the region, right, they're really seeing that promise as well. So I feel like we're making good headway. I'm hopeful that after the 5-year plan comes out, we'll really dive into building out the sub-regional plans that align with that 5-year plan. And my hope is that through those sub-regional plans, we really cement all 39 communities being part of the authority and moving forward in the same way.
Yeah, indeed. All right. Well, last thing, one of the things we hear a lot in the course of our work, we've even heard, discussed in prior navigates, is, a frustration from the local community that, we declared, an emergency, we had the emergency declaration over 10 years ago. We've had, what's perceived as large investments and, folks in the county not feeling like they're seeing results, right? And this is one of those things that I started at Compass in 2015 when we were taking double-digit, low 20 percentage point year-over-year increases in homelessness. And I can say we were burning as fast as we could. We were burning the candle at both ends, and we could not keep up with the flood of people out, basically going from housing out into the streets. And so when community members wonder what is happening, I think part of our job, part of the reason why we're here in conversation today is to give you some insight and engage a little bit more on what is really happening, right? Because we have the luxury, Mark, Nathan, us at Compass, we have the luxury of seeing what's happening on the ground every day, seeing just truly incredible collaboration to affect the lives of individuals. But I know not everyone can see that. So Mark, do you want to speak to that at all?
I think, I mean, that's a lot to go out on. I think, I think, my perspective is, I don't know how to say this with grace, particularly because I'm so tired, so I'm just going to say it. I don't think we should be defensive about our work at all. We do I almost swore, we do incredible stuff every day. Like, and you know, the work that I have seen folks in this community do to rally together to, again, address like these, like, you know, the Dearborn encampment had been there for so long it had a name, right? Like, and when we started engaging, people were like, yeah, this will never work. These people, they're going to be here forever. And again, I was like, I just don't think that's true. And I don't think our community believes that's true, right? I don't see any reason why we should act like that is the case. And so, you know, I think that I would offer that, like, some of where the disconnect lies is in these discussions. Oftentimes people say things like, well, everything is messed up. And we often then get defensive and talk about how, you know, well, you know, we don't have enough money, we don't have this, we don't have that. And again, I think that if we could shift how we had the conversation, so rather than, you know, being defensive and saying like, you know what, like, you're right, this is clearly messed up. No, like, no community should have this many people who live outside. Something is broken. Something is broken, right? And like that's just completely true. Like, any country that has this many people who have to live outside when we have this much money, something is broken. But what I know isn't broken are the people who are working every day to help people come back inside. Because to your point, those people burn the candle at both ends. They work for way less money than they are worth. And they do it oftentimes because of their own personal connections to the housing instability that happens in this country. And so I think that, like, how we need to start responding to this is more of a hey, wait a minute, and more of a yes and, frankly, right? And I know that sounds a little bit Pollyanna, but I think it actually would go a long way towards helping to stabilize how we talk about this, so that, again, we are having the more appropriate discussion and we're saying, like, you know what, look, like, I think I agree with you. Anytime I walk past people who have to live in tents outside, I know something is wrong. What isn't wrong is the outreach staff who are working to connect with those people every day. What is wrong is that they don't have resources to connect those people with. That's the problem, right? So let's start, again, centering our discussion in where the breakage is, so that we can all start getting, frankly, animated about the right stuff, instead of going back and forth about, again, whether or not people who, you know, almost deliver babies in outside of care settings deserve $15 more an hour. They do. They just do. That's correct. And we need to build the resource continuum that can connect with everyone in our community who needs it.
Yeah, thank you. So all of you, this 5-year plan has been released. We're rolling into eventually the system will be there will be a reorganization of how the regional authority funds the system, and that will be angled at how the authority wants to see those levels of success that were identified in the presentation. So when you all are thinking about, okay, what's happening next with Marc and the authority, I mean, I think that's a good summary of what's next. Is there anything you want to add to that?
No, I mean, like, you know, call us. I'm serious. I am serious. Like, you see something, please say something. I want this to be everybody going in the same direction, because I also, you know, I'm not going to be here forever in this job. Like, again, the authority is only going to work as a concept if it's all of us making things happen through that vehicle, not a couple people, you know, doing stuff. Like, that's not the goal. The goal is collective impact. And so I really hope that we can get there.
Yeah. All right. Well, thank you everyone for joining. I've got a couple things I want you to know about. Everyone, please first give a big thank you to Marc for shining a light on this critical plan tonight and for bringing a lot of passion, even though they're on an empty tank. I also want to thank you, our audience members. We so appreciate you taking the time, especially on a sunny night like this, to attend and engage in conversation with our community. The recording of this event will be available on our website in a few days. We'll also be sharing it out via our e-newsletter at the end of the week. If you haven't signed up yet, you can do that through the link in the chat. And also we value your feedback. This is still a new format for us. We're only in the very beginning of our second year. So we are going to be dropping a link in the chat to a brief survey because we hope you'll share your thoughts with us. We will be announcing the next Navigate's topic and speaker in a few months, so keep an eye out for that in our e-news. And I'm also, to Marc's point about creating that feedback loop, I'm going to go ahead and also put the KCRHA's email address in the chat as well for those of you who want to hang out and capture that. Because, you know, we believe that everyone needs to put a shoulder in and push and really care about our community and show up. And part of that is engaging in conversation. So I'll go ahead and put that email in the chat. And thanks again, everyone. Thanks to you, Marc, and have a great night.
Thank you, Marc. Good night.
Thanks for having me. Bye, everyone.
Thank you.
Thank you.
Oops. There, I think the email address worked there. Yeah, info@kcrha.org. Great. Thanks, y'all. Thanks, Nathan. Appreciate you pulling the strings in the background there. Do you want to end the recording and we can get it downloaded? Awesome. All right. Thank you.